Hi there, my name is Oliver. I am 19 years old and I am a full-time mental health technician. So since I had turned about 10 or 11, I knew that psychology was something I was going to be very interested in, simply because I struggled with my own mental health. So since I was about in middle school, I knew that I wanted to try and help people. I took my first psychology class when I was in my junior year of high school, and it changed my whole life. It just kind of deepened my interest in the subject. So instead of just knowing from my perspective what my mental health journey had been like, getting to really see like proper diagnoses and symptoms and stuff like that, it was really interesting to me. I started at my job as a mental health technician on August 6th, 2018. So I've been there for 5 months now. I wanted to get this job just because I knew that psychology was something that I wanted to do. So I thought that if I could get a job in the field and go ahead and start earning that experience while I'm in school, that it would really put me ahead. And after speaking with my academic advisor, she agreed that that experience is something that colleges are really going to look at. Because right now I am going to get my associate's degree at a community college in Kentucky. And I'm just getting my associate's in arts since they don't have a psychology program. I am currently a sophomore. After I get my associate's, I'm going to transfer to a bigger university and I want to get my bachelor's in psychology, and then I would like to transfer again eventually and get my master's and or doctorate in psychology. So working as a mental health technician is very hard. It is mentally draining, it is physically draining, it is emotionally exhausting, but I love my job. And keeping jobs have been something that it's been very difficult for me since I've been able to work, just because I was going into jobs that I felt like weren't really progressing me towards my career goal. And they weren't. I mean, stocking shelves at a grocery store and serving burgers wasn't really helping me in that field. So once I started at the hospital I work at now, I was very excited to start, but I think I was ill-prepared because I believed I was ready because I had been in such a good mental state. But it's really hard, especially when you have dealt with some of the issues that people there are going through. It can be very triggering if you're not ready for that. And I went in without having coping skills lined up in case that situation arose. So after being there for about a month and a half, I really I had my first mental breakdown, and I just went to my car and just cried for an hour. And I didn't think I was going to be able to do it. I thought I was going to have to stop. But I spoke with my supervisor, we talked it out. I spoke with my therapist, which I highly recommend. If you were going into this field, you need to have a therapist or a treatment team lined up, because that is the only way you're going to survive. Because we're all human. It doesn't matter if you've had any issues like that in the past on your own. We're all human. We make mistakes and we have emotions, and we have to take care of our own mental health before we can take care of somebody else's. So basically my job title is I am on the floor with the patients every day. I do Q15 checks, so I check every patient every 15 minutes to make sure that they're safe and alive. I do safety checks every day, so we go through the milieu, just like the common day room, to make sure there's no contraband, anything that anybody could harm themselves with. And then also their rooms to look for contraband, and just food, because patients really enjoy keeping food in their rooms, even if it goes bad. Which I can understand, getting hungry, because I have been inpatient myself 3 times in the past, so I completely understand where they're coming from, but per the rules, patients aren't allowed to have food in their rooms. So I work on the unit with the detoxing patients, the chemical dependency patients. Our census can go up to 20. I work second shift, so I'm there from 3 p.m. to 11 p.m. Their day really gets slower as the night progresses. During the day, like for first shift, they have lots of group art meetings, stuff like that they attend. When I get there, it's really just dinner, then they might have one or two more groups, and then it's hygiene time. So it's a lot slower. I get a better chance at building rapport with patients because they're just kind of hanging out on the unit, so we can talk and get to know each other, work through treatment planning, stuff like that. What to expect when you start working as a mental health technician. When I started, I filled out a bunch of applications. Nowhere would accept me simply for the fact that I didn't have any experience and I didn't have any schooling under my belt. I was a freshman in college at the time, so I didn't have any college degrees, and most places require that. But I got lucky with the place that I'm going to. Is when I went to my interview, she said, as long as you're compassionate about people, you'll do just fine. So as long as you're compassionate and willing to learn, really anybody can do it. So I went to my interview. I got a call about 3 days later, and they said that they would love to have me on their team. So they brought me in for orientation. Orientation was a 1.5 week long process. We started just with PowerPoints and presentations, meeting with other members of staff, learning about verbal de-escalation and warning signs and red flags for stuff like suicidal tendencies, relapse, self-harm, stuff like that. Then later on, we did a handle with care. My hospital uses handle with care as a restraint technique. We don't use mechanical restraints at all. Obviously, the first step would be to try to verbally de-escalate somebody before we have to put them in a hold. So if somebody is an imminent risk to themselves or to others, be it staff or patients, we will put them in a hold just until we can get them calmed down and stabilized. So what to expect when you start the job? Expect to be overwhelmed. If you're going into a facility like I work at, there's going to be a lot of patients. The census is going to be very high, and they're going to be needy. And that, I don't mean that in a negative way. It's just how it is. They've lost all of their control, and they can't do anything on their own, so they look to you for guidance for it. They can't go do their laundry on their own. They can't go to meals on their own. They can't smoke. They can't, all this stuff. So that when they look to you, it's simply because none of it's in their control anymore. And that can be very aggravating for people, and I completely understand. So expect it to be very, very fast-paced, especially what season you're going into it. I started during the summer, very busy. School kids were in. Mood was a little better in the summer, simply just because, the seasonal mood disorders weren't really acting up for a lot of people. But in the winter, census does tend to go down, which is, it's kind of a back and forth with that, because it's like depression usually skyrockets around the holidays for people that don't have a support system, or the seasonal depression kicking in, stuff like that. But census goes down simply because people are spending more time with their families, and I don't know. It's kind of a back and forth. So expect fast pace, expect to learn a lot while you're there, and expect to help people, but also help yourself, because not only will you be learning a lot about the field, you're going to learn a lot about your own personal interests and things that you might not be able to handle. I'm still taking notes, personal notes, and trying to figure out my triggers before they happen, and what I might not be able to deal with yet, which it's okay if you can't, because if you're in a spot like me, you just have to tell yourself that you haven't been through all the training that professional, licensed therapists have been through yet. You don't know how to leave your personal life at the door. You don't know how to leave work at work. You'll still bring it home with you, and that's okay. But if it ever starts to get too difficult where you're not sleeping and you're not taking care of yourself and you're just overwhelmed all the time, then speak up. don't be afraid to ask for help. Everybody there will be supportive of you and understanding because they're going through it too, or they might have been through it too. So don't be afraid to ask for help, speak up about your struggles, and take a break if you need to. Just remember to take care of yourself before you try to take care of other people. Anyways, so that was a little glimpse into my life as a mental health technician. I hope that was helpful for some of you. If anybody is interested in going into this career field or looking into psychology as a pathway in the future, I think that this is a very good place to start. The need for mental health technicians and mental health workers is on the rise simply because people feel safe enough to be more open about their struggles. So I applaud you if this is your chosen career field. Thanks for watching. My name's Oliver again. I hope you have a rad day. Bye.